What's up, everybody? I'm Dr. Garrett Rossi, a board-certified psychiatrist making mental health content here on YouTube. And if you're new to the community, I would love to make you a subscriber. It really helps me to know that this material is valuable to you. And if you're a returning viewer, thank you so much for your support. Today, I just have so much exciting stuff to tell you. I feel like I always have exciting stuff to tell you guys lately. I've been on a roll here with exciting new developments in psychiatry, and this one is just as good. And what I'm going to be talking about today is MDMA, Ecstasy, Molly, all that good stuff. Can it really be used to treat post-traumatic stress disorder or PTSD? What does the science tell us? Let the science guide us. Here we go on this journey. Can MDMA treat PTSD? Let me give you guys a little background first on MDMA. And I'm going to tell you some stuff like you've probably never heard anywhere else. And it's exciting because I love this stuff. It's just really exciting to me. So hopefully it's equally exciting to you. So MDMA, it's an enactogen, and it overlaps in chemical structure with none other than methamphetamine, right? Methamphetamine, the terrible drug that people use, get all those sores all over their face and all that good stuff, right? So methamphetamine, it also has some structural overlap with mescaline, which is another psychedelic medication, and has biological effects similar to those of epinephrine, dopamine, and serotonin. Hey, there's those monoamine neurotransmitters again, right? So people who say that these monoamine neurotransmitters don't have any effect on mood and don't have any effect on depression, right? Well, I don't know what they're talking about, because even if you're a big proponent of psychedelics, all of these psychedelics seem to function in a similar way and usually have some effect on at least one of those monoamine neurotransmitters. Now, how does MDMA do what it does, right? Why is it helpful? What is the mechanism of action? That's always a good question. It's always something you want to ask yourself whenever you're looking at psychiatric drugs, is like, how does it actually work? So it of course increases the release of monoamines through the reversal of transport proteins and reuptake inhibition. So not only does this block the reuptake of monoamine neurotransmitters into the synaptic cleft, or from the synaptic cleft into the presynaptic terminal rather, it also will increase the release of these monoamine neurotransmitters. So specifically serotonin and norepi being the ones that it has the largest effect on. And not only does it block the reuptake of serotonin and norepinephrine, it actually enhances the release of it as well. And that's because it works as an inhibitor of VMAT, vesicular monoamine transporter. Now this is the transporter that packages monoamines into synaptic vesicles for release into the synaptic cleft. And what will end up happening is these VMAT, if you inhibit VMAT, you're going to have more serotonin and norepinephrine, for example, to release into the synaptic cleft because it's not being stored away in these packaging vesicles. So it prevents the packaging of monoamines into vesicles, making more available for release. It also modulates glucocorticoids. So MDMA does a bunch of stuff. It's kind of wild. It modulates glucocorticoids through the hypothalamic pituitary adrenal axis, HPA axis for short. And it's going to decrease amygdala and hippocampal activity, because that's one of the main things that we want to do, right? We want to shut that fear response down and we want to reconsolidate those memories in PTSD. So obviously effects on the amygdala and hippocampus are going to be important. It also increases oxytocin. And oxytocin is normally the empathogenic part of the medication. It's the part that makes you feel more connected to others. And it increases blood flow and prefrontal cortex activity. So wow, that's a lot to unpackage. That's a ton of information. And it has multiple mechanisms by which it could potentially treat PTSD and other psychiatric disorders such as depression or anxiety. Believe it or not, MDMA actually started out as a therapeutic agent. It was actually originally researched for medical purposes. And you might be asking, Dr. Rossi, what the hell were those medical purposes? Were they psych reasons? Were they to alter your mind? Or to control your mind? No, they were not. Actually, it was therapeutic. It was actually investigated as a therapeutic agent for blood clotting. So this would be used in post-surgical patients or those who had excessive trauma, say a trauma patient who comes in after a gunshot wound, for example. They were going to use MDMA as a clotting agent. Turns out, and you might be surprised by this, it doesn't work very well as a clotting agent. It really doesn't work. So this indication fell through. Who would have thought, right? Now, it's currently a Schedule 1 drug, right? So as a result of this failure to work as a clotting agent, it was then listed as a Schedule 1 substance here in the United States. And if you don't recall what a Schedule 1 substance is, it's defined as having no accepted medical use. So it has no accepted medical use, it has a high abuse potential, and a lack of accepted safety. So how are we taking a Schedule 1 drug, MDMA, and turning it into a therapeutic agent? So I love this, right? I really do. We have to talk about how the Schedule 1 drug became interesting again as a potential psychiatric medication to treat PTSD. So somebody out there, God bless them, decided to dust off MDMA, right, and take it off the shelf, and they were excited about it because one of the big things that that users noticed, right? Again, we're talking like recreational users. We're also talking about, clinical trial data that they had from those original clotting studies. It had what they call empathy generating effects, or it acted as an empathogen. This is all kind of hard to say, to be honest. I'm struggling a little bit here. But it acted as an empathy enhancing drug, and it also acted as what some people might call an empathogen, right? Helping individuals who use it to feel more connected with their fellow human beings. And I always say, after all, isn't that what all of us want in life? We just want to feel a deep connection with other people. We want to feel like other people truly understand us and care about us, right? So if I can take a medication that's going to help me to feel that way, it's going to potentially be beneficial to my overall mood and to my overall state of well-being. Now, the FDA then, after some of these studies, has approved phase 3 trials testing MDMA for PTSD. So we're pretty close to getting FDA approval for MDMA for PTSD treatment specifically. Now it's under investigation for other disorders too, but PTSD is most likely the one to gain FDA approval. Another interesting fact that you guys may not be aware of is that the original name for this drug was empathy. They wanted to call this drug empathy, which makes sense, right? It's an empathogen, makes you feel more connected to others. Why not just call it empathy? I mean, what a great name, right? But this has changed over the years. I mean, obviously the street names are things like Molly or Ecstasy, right? And personally, I like names that describe what a drug does. As I've been trying to tell you guys, I don't like the idea of calling medications antipsychotics or antidepressants. I like calling them by their mechanism. A dopamine blocking agent, a serotonin reuptake inhibitor, right? I like calling them by what they do, and that's how other areas of medicine classify their medications, so why not call this empathy? I like the name. It's just so much more marketable too. So why not just call MDMA empathy and market it out for PTSD treatment? Now, it caught on, right, as a party drug. So that's primarily how most people know MDMA or Ecstasy or Molly, is they know it as a party drug, and especially those parties involving lots of EDM, dancing, pacifiers, right? And a little known fact, people don't always know this, but some people might, and if you've ever taken the drug, you might know, that it causes bruxism or teeth grinding. So to prevent the teeth grinding, people would often carry something around that they could put in their mouth, kind of like a mouthpiece to prevent them from grinding their teeth down while on Molly. So that's why you used to see people at those old rave parties carrying around pacifier attached around their neck usually, or sucking on the pacifier while dancing on the dance floor. I'm going to tell you guys my story of why I think MDMA has become such a popular topic and why we're researching it now as a potential therapeutic agent for PTSD. As many people probably know, there have been several recent wars, right? There was the war in Iraq, there was the war in Afghanistan, and America had a PTSD problem with many combat veterans who were returning home and requiring treatment. And anyone who's ever delivered treatment for PTSD, if you've ever done trauma-focused psychotherapy with an individual, if you've ever tried medication-based treatments like sertraline or something like that, for example, you know how difficult it is to treat these symptoms. It really is very, very hard. Whether it's therapy and medication combined, it doesn't really seem to matter. It's very difficult to treat PTSD. So with that said, many patients are unable to really sit with the discomfort required to reconsolidate these memories, right? So we have these memories of the trauma, and we need to reconsolidate them in a different way. We need to alter them and reconsolidate them in a different way. And if you were to do trauma-focused therapy, the person could theoretically, with PTSD, get through the trauma-focused therapy and reconsolidate those memories effectively. However, again, most people cannot sit with the discomfort. They stop therapy prematurely. It's too emotional for them. They really just can't handle it. Others don't have access to the treatment because there's nobody that delivers trauma-focused psychotherapy. That happens a lot in my practice and my patient population. Many people don't have access to good therapists, so they can't even get trauma-focused therapy. Whatever the reason is, it's not working out very well, right? And having worked at the VA for a year, I was surprised by the number of veterans that had non-combat related PTSD. Honestly, they were probably the vast majority of my cases. They were people who had accidents while working or had an accident during their training and while they were in the military, and subsequently developed PTSD that way. Now, the idea that we need methods to enhance the efficacy and speed of trauma-focused psychotherapies is not necessarily new, right? This is an older concept. We know that it takes a lot of time, energy, and effort on the part of the therapist and the patient to get through trauma-focused psychotherapy. So anything that's going to help speed up that process, relieve symptoms faster, and make the therapy easier to get through is going to be a good thing. So what better way to do that than with our new medication, empathy, right? Empathy, a medication that enhances feelings of connections. The basic idea being that patients would be given MDMA and then undergo psychotherapy using the medication, and it would work, the medication would work or enhance the therapy by influencing fear extinction and memory reconsolidation. And this occurs by several mechanisms, like I've detailed at the beginning, but you're obviously going to have effects on dopamine, serotonin, brain-derived neurotropic factor, cortisol, and oxytocin, all of which are going to, in one way or another, enhance the psychotherapy that's being delivered by the therapist. And the concept of using psychedelics, I want to just point this out real quick for you guys. The concept of using psychedelics to enhance the effects of psychotherapy is not new. This concept has been going on for years. It was originally with LSD and other psychedelic compounds, but what is different now is we are trying to put the scientific rigor behind the studies to prove that it works better than placebo or better than medication or therapy alone, right? Or current standard medications and therapy alone, right? We're trying to put that scientific rigor behind it, and we're also trying to learn more about the mechanism of action and why something like MDMA could be beneficial for the treatment of PTSD. There's an overarching theme, I think, in all of the psychedelic research that I've read and reviewed, and that is that all of these psychedelic medications seem to enhance neuroplasticity, right? Neuroplasticity, big word. But what that really means is it enhances our ability to make and form new connections in critical neurocircuits, right? We don't think about in psychiatry anymore about things like chemical imbalances and just like you're deficient in your serotonin, you're deficient in your dopamine, or whatever the case is. We think about how do we alter circuits that have gone awry, circuits that are inappropriately connected. And that's what we're doing here. When you enhance neuroplasticity, you make it way easier to change these neural circuits than otherwise would be accomplished with therapy or other medications alone. So that's where I think psychedelics really are gaining a lot of popularity, because enhancing neuroplasticity is not the easiest thing to do. And that's where these medications shine. During psychotherapy, MDMA is thought to have many effects on the brain. And I'm going to go through each of these. These are, at this point, fairly theoretical. They still need to be teased out, but these are the early preliminary data that we have. The number one thing that I'm going to say is that it works by multiple mechanisms. So it targets blood flow, it targets molecular changes, and neurocircuitry changes, all of which enhance psychotherapy effects. The first one is increased blood flow to the ventral medial prefrontal cortex. So there's going to be enhanced blood flow and of course enhanced activity then of the ventral medial prefrontal cortex. And this is going to decrease activation of the amygdala, which is largely responsible for the fear response. The amygdala is an almond-shaped object in your brain, or structure in your brain. And it got its name actually because it tastes like almonds. Well, that's a joke. It's not true. It doesn't taste like almonds. It actually is because it looks like an almond. So that's how it got the name. But anyway, it's a joke that I like to use sometimes with my residents and medical students. So the amygdala is responsible for the fear response. And obviously, if we can mediate that response, we're going to have a better effect in PTSD. Another potential mechanism is enhanced production of BDNF, brain-derived neurotrophic factor, which improves the long-term potentiation and memory reconsolidation abilities of the person's brain, which is important because a lot of PTSD treatment, whether it's psychotherapy or medication, is focusing on changing and reconsolidating those traumatic memories. Another potential mechanism is it elevates the stress hormone cortisol, which interacts with glucocorticoid receptors in the hippocampus to improve memory. So there's a lot of glucocorticoid receptors in the hippocampus, and enhancing cortisol interaction at those glucocorticoid receptors can enhance or improve memory function. It elevates the prosocial neuropeptide oxytocin. So oxytocin is a prosocial neuropeptide, and this actually, the increased activation of oxytocin actually decreases activation of the amygdala. So again, we're dampening down that fear response. So this is going to help us to achieve that goal as well. And it enhances connection with the therapist, which is good because we know that the therapeutic alliance between the therapist and the patient are essential factors in determining outcome of psychotherapy. The next thing is increased levels of dopamine, which can destabilize old memories and help reconsolidate new memories, new more effective memories. You can have increased serotonin levels resulting in prosocial and positive affective states. So there's a whole bunch of stuff going on here. And the goal of PTSD treatment as a whole is to prevent the patient from being held hostage by these memories. Right now, the patient is under the influence and being held hostage essentially by their traumatic memories. We want to destabilize the old memories. We want to modify them through psychotherapy. And then we want to reconsolidate the new memories and then enhance and strengthen that neural circuit. The trauma still occurred, right? It doesn't change the fact that this trauma that the patient experienced still occurred, but the patient no longer has the same fear reaction. They no longer have the same autonomic reaction to these memories. All things have a price, right? And as I've said in my other videos and said multiple times, all medications have side effects, even placebo has side effects, so there's got to be some potential adverse effects of MDMA. So what are they? Number one, the most important thing with any of these Schedule 1 substances, any of these Schedule 1 drugs, is the potential for abuse and diversion. Obviously, there's going to need to be things in place to prevent the diversion or abuse of these drugs, so probably no take-homes for people who are in psychotherapy assisted with MDMA. Another concern is the possibility of hyperthermia or hyponatremia. So this is more common in recreational use environments, so when people are using outside of the clinical context, but these things are concerning. So people who are taking Molly or Ecstasy, they often engage in prolonged physical activity, such as dancing, in hot environments. So like a crowded club scene or an outdoor party during the summertime, whatever the case is, it's hot and the person's not consuming enough water usually. As a result, they become dehydrated and they can potentially become hyperthermic, and that can cause severe medical complications. Now, think again, large dance party. Hyponatremia is the opposite case. So in this case, the person is aware that their body temperature is going to get elevated, that they're going to be moving a lot during the night or whatever it is at the party, and they overcompensate by over-consuming water. They drink a ton of water. And obviously what that's going to do is that's going to dilute your blood, and it's going to cause your sodium levels to decrease. And if your sodium levels decrease too much, too fast, then you could potentially have neurological problems, right? This is a common issue. And you may need to even be hospitalized to have your sodium repleted appropriately and at the appropriate rate to prevent something called central pontine myelinolysis, which can really be terrible. So you have to be careful if your electrolyte balance becomes that far off. And again, this is a concern with people who are using MDMA. There is this other effect that I want you guys to be aware of, and it's called Blue Monday and Black Tuesday. So when somebody uses MDMA, it can cause low mood, irritability, and fatigue for days or even up to a week after recreational use. So if someone's ever used this drug before, or you've ever worked with a patient who is a user of ecstasy, then you would know that there's periods where after use where this person can again be very irritable, low mood, be really tired, sleeping a lot more than they normally would. And so this is the quote unquote Blue Monday. And then the Black Tuesday is add in some suicidal thoughts there, and now you got your Black Tuesday, right? In the clinical setting, there were observations during the studies of patients complaining the week after treatment of having fatigue, anxiety, low mood, headaches, and nausea. So you got to be mindful of the fact that there are changes in mood. These are psychoactive compounds, and you have to be careful using them. Okay, so to wrap the video, what I will say is, like psilocybin, like all the other discussions I've had up to this point, I am very excited about the therapeutic effects of these medications, but I think we need to keep in mind that caution needs to be taken as we are really playing with fire here, guys, right? And when you play with fire, you can potentially get burned. So we don't want to get burned. We want to make sure that what we're doing is safe. And safety, in my mind, is as important as efficacy. I want effective treatments for PTSD, but I'm not going to sacrifice safety and scientific rigor for that efficacy, right? I want these to be safe medications. And what Hippocrates said is, as to disease, treat and at least do no harm, right? So he basically said, treat, at the very least, try not to harm people, right? So we want to treat diseases, we want to have safe and effective treatments to do so, but we also want to prevent harm. And that's why I encourage us to let the science guide this process, right? Let's let the science dictate how we use this medication, who we use this medication for, and when it's appropriate, right? I want relief from debilitating disorders in psychiatry just like everybody else does, but we need to be careful and mindful of how we go about getting that relief. I'm going to hold the video there, guys. Thank you so much for watching, and if you haven't subscribed to the community already, please consider doing so, and I will catch you guys next time for the next video in this series.